You're listening to C103's Cork Today podcast. Phone and text lines are currently closed.
Our first nutritional slot of 2024, Anneliese of the Health Hub Times Square in Ballincollig joining me. Good morning and a Happy New Year to you, Anneliese.
Good morning and Happy New Year to you, Patricia, and everybody who's listening as well.
Okay, we've all recovered. Did you overindulge?
Of course I did. And I enjoyed every mouthful.
And that's all part of it, isn't it?
It is, of course.
Yeah,
it is.
Yeah.
Actually, to be honest with you, I think that you probably end up eating a lot more sweet stuff than normal over Christmas, and that gets all that sugar craving going, and that's the real difficulty in then coming into January, is kind of giving up all that sweet stuff because you give yourself a free pass. So I suppose that's the unhealthy aspect of it. But other than that, for God's sake, for the sake of 10 days, isn't it? It's lovely.
Yeah. I just think households that are, and I'd have to put my hand up and say there's a lot in my house, there's still a lot of leftover boxes of sweets and chocolates and biscuits that I'm kind of looking at and thinking, I might donate those to charity, because if you have them around the house, that's the danger, that we're into the middle of January and you're still eating the tins of roses.
Absolutely, and you don't want to waste them. So once they're open, you'll finish them. So actually, that is the best advice, Patricia, is just give them away. So I have stuff stacked up at home now, extra boxes of sweets and biscuits, and they're going.
Yeah.
I'm just getting rid of them.
Get rid of the temptation. Get rid of the temptation. Okay. A lot of people have been on to us this morning, and it's there was a lot of COVID out and about over Christmas. And again, it comes up every time, people recovering after COVID. Summed up by Anya, who says Happy New Year to us both. Many happy returns, Anya. She's coming towards the end of COVID. She's taking something called Oxylent, but she wants to know, what else would you suggest? She's lacking in energy, and that's what a lot of people are saying. They still have that real tiredness even though the COVID is gone.
So generally for energy, ginseng is the best to kind of get you over that hump. I do think that is one of the side effects of COVID, and certainly for a lot of people who end up with long COVID, the fatigue, chronic fatigue, and fatigue is a big part of it. But even for most people, after a virus, it takes a couple of weeks, I think, to bounce back after COVID, whereas a lot of people would bounce back much quicker from a flu or from a cold. So the first thing I would say is just accept that you will feel a bit tired for a while. That is part of the after effect of the virus, and don't push your body. So for example, now, if you're feeling like that, don't start going to the gym and doing a big new program, because actually that's going to set you back. Just make sure that you're getting your rest, and do listen to your body if you're feeling a bit tired. And then to get you over the hump, the B vitamins are always very good. Now, Oxylent is a great multivitamin that comes in a sachet. You can mix it up to a drink. So the B vitamins will be in that. That's fantastic for energy. I actually think the N-acetylcysteine was great for me when I was getting over COVID. It was great for my chest and good for energy as well. It's called NAC, N-A-C, and you'll buy that in any health shop. And then ginseng is great for a bit of an immediate energy buzz. It kind of gives you a caffeine-like boost, but without that jittery feeling of caffeine. So one of my favourite ones, and the one I was taking, was the Terra Nova Dynamic Synergy, which is a blend of mushrooms and different types of ginseng. So you get a lovely energy buzz that kind of lasts for a good few hours, and then the mushrooms are fantastic for the immune system as well. So any of the three of those I would recommend, or a combination of the three of those if you're really feeling quite low.
Okay, and Jason in Clonakilty, and again, this is one I've heard a lot of people complain about. Jason was on to us this morning to say, I've got what he describes as a hacking cough. He said, I've had it for the last 3 weeks. It simply will not go away. I've tried everything. Is there anything that you could recommend? I did have a chest infection, which brought on this cough. The chest infection, I'm well over that, but it's the cough that is lingering, and it just won't go away. A hacking cough.
Yeah, and it's very common, Patricia, at the moment. And I actually remember the year before COVID, there was the 100-day cough. People were getting it was a really bad year. People don't remember this pre-COVID, but it was a really bad year in the hospitals. There was a big spate of very bad flu virus, and there was problems with beds in hospitals. But one of the results of that was this 100-day cough, so people could not shift the cough afterwards. And I'm seeing that again at the moment. So I think, again, it's probably something to do with inflammation in the lungs. So really you may need to check with your doctor because you might need something like a steroid to bring it down. Some people do develop asthma after COVID, temporary asthma. So again, steroids would be beneficial for that if there's inflammation in the lungs. And it's this kind of dry cough, so it's not productive. There's no mucus in the chest, so it's not an infection. I think it's down to inflammation of the lungs. So there's a couple of things that I would recommend for that. I think the Dr. Claire Mucotone is very good because there's herbs in there that nourish the chest, the cells of the lungs, the lung tissue. And she also does something called a Clearaway tea, which I took for my lungs after COVID. So I was my own best guinea pig, Patricia. And I found the Clearaway tea was very soothing. And then what I used was the Comvita Manuka honey cough elixir. And instead of taking it as they recommend, which is 2 teaspoons 3 or 4 times a day, I would take a sip of that every time the hacking started. And I would just kind of let it trickle down my throat, and it soothed all of those inflamed membranes in my throat and my upper respiratory part. So I was less likely to get into those terrible coughing fits. So you could try those things. The olive leaf extract is also another fantastic natural anti-inflammatory. I took that as well as my kind of go-to when I'm feeling a bit run down after feeling sick. So that could be another one you could add as well. And then finally, that NAC, the N-acetylcysteine, we've had amazing feedback on that since people were getting COVID and respiratory. Even some people who took it for respiratory after effects of COVID said that they experienced far less asthma and far less hay fever coming into the summer when they were taking it as well. So again, it must have some very beneficial anti-inflammatory effect in the lungs.
Okay, Emily in Fermoy has what she describes as a sore eye. Her eye basically is red. She can't figure out what's wrong. She says it isn't sore, it isn't itchy, and she can see fine, but it's just a redness in her eye. Any idea what that could be?
Could be any number of things, I suppose, Patricia. Sometimes you can scratch the surface of the eye, a little scratch, and that can cause irritation. Takes a little bit of time to heal. You could buy some eye drops that are like, normal tears in the pharmacy or in a health shop, and they would just help soothe it a little bit if it is a scratch. It could be the start of an eye infection, which would mean you need antibiotic eye drops. It could be the start of conjunctivitis, which is actually more serious. So there's any number of things it could be, but if she can see through it and if it's not itchy, just red, I would say that she's possibly got a bit of grit in there or possibly rubbed her eye and scratched it.
Yeah, and didn't even realise it.
Yeah, probably something like that. So I think eye drops, and there is natural eye drops that you can get in the eye shop called Dr. Vogel does them, and there's Eye Bright in there, which is a really lovely herb for the eyes, for eye health. It's great for dry eye. It's great for eyes that get infected. It's great for tired eyes if you've got a lot of screen time. So you could try that as the eye drops.
Okay, and Joe has emailed the programme. He's a 72-year-old man, and he said this has only developed recently. After eating, he's getting a rumbling sound in his stomach. He's getting gassiness and wind. It can actually wake him up at night. He's wondering, is it the particular food he's eating? If so, what food should he avoid? And would you have any natural remedies for it, please? So a rumbling sound with gassiness and wind after eating.
So I suppose there'd be a lot of questions I'd ask a person who'd come into the shop with those problems now. I think it's possibly an issue with digestion, but again, it might be that the diet has changed recently and there's something that's causing, is becoming more difficult to break down. It's possible that a new medication is causing this. So there's a few reasons why your digestion might be affected. Like if you start taking those antacids or the Nexium type things, the omeprazole, they can all cause this as well. So I don't know if it's as a result of any of those, but the first step really, I suppose, is to try something like a digestive enzyme that will just help support the body's own natural breaking down of food and digestive ability. So the Udos do a great one, Terra Nova do a fantastic one as well. So go into the health shop, get yourself a good digestive enzyme. And if that doesn't sort it out, then you need to, if there's been antibiotic use recently, maybe it's down to the fact that there's an imbalance of bacteria. So maybe a probiotic could help. But I think first stop, the digestive enzyme. And actually, Patricia, a lot of people in France and other countries in Europe, they actually have a salad or something very bitter to begin their meals with. And it's because it stimulates the gallbladder to release those digestive enzymes. So having a glass of lemon juice before you eat, or maybe even a glass of water with some apple cider vinegar stirred in, can be a great way to stimulate digestion and avoid this kind of rumbling and gassiness. But if you've got heartburn, that is definitely not suitable for you. Otherwise, it's worth a try.
Okay, and Dorothy in Dunmanway, any suggestions to get rid of mouth ulcers? She's had a lot of them after Christmas.
So mouth ulcers can be a sign that your body is just struggling and you're run down, that you've been burning the candles at both ends. Or it sometimes as well can be as a reaction to. Some people notice it for berries. Some people notice it for certain toothpastes. So in toothpaste they put in a chemical called sodium lauryl sulfate to produce the foaming. And a lot of people that get mouth ulcers have a problem with that. So I would recommend getting a natural toothpaste that does not have the sodium lauryl sulfate in there. Dr. Dealish Clare does a fabulous mouthwash that is brilliant for healing ulcers and anything. It's great for people who've got gingivitis or an infection in their mouth or really bad breath or sore tongue. So that's her mouthwash. There's myrrh and echinacea in it, so it's not like a kind of a standard mouthwash. It's more of a healing one. And you could take a vitamin C and zinc supplement if you wanted as well, because these are both really important for skin and the healing of skin. So if you find that you've got very slow wound healing, it can be a sign that you're deficient in vitamin C and zinc. It's always a great one to take for any type of healing. Even if you break a bone, it's another great one to take for healing as well. So you could try that.
Okay, listen, have a lovely week and we'll talk to you next Monday at your usual slot. Thanks for joining us. That is Anneliese Dressel of the Health Hub Times Square in Ballincollig, and all of the information contained in Anneliese's slot today she'll put up on her own website, healthhubstore.com, and John Paul will put it up as a separate podcast here on C103.